Hello beautiful people, welcome back to my YouTube channel. Guys, if you are watching this video for the first time, please consider clicking that subscription button, and if you are a returning subscriber, thank you very much for always clicking in. Share my video, like and comment. Tell me what you want me to talk about in my next video. I will consider that. I will always consider that. So guys, yesterday in the news they were talking about swine flu, homa ya nguruwe, and people were like, kuna kwanga na homa ya nguruwe. Kuna kwanga na homa ya nguruwe and inaitwa swine flu. So what is the cause of this swine flu? Swine flu, yes, it is swine flu. That is how I'm going to pronounce it. What is the cause of this swine flu? What are the signs and symptoms? And when it attacks you or when there is outbreak, how can we prevent it? I will be talking about that in the next few minutes. So please make sure you continue watching this video up to the end. So swine flu or homa ya nguruwe refers to influenza in pigs, and occasionally pigs transmit influenza virus to people, and mainly in hog farmers and veterinaries, those who are dealing with animals, doctors of animals. That is, those are the people who are mostly the what these virus mostly attack. And in less cases, it can be transmitted from one person to another. And it was first recognized, this swine flu, it was first recognized in 2009, and it was a pandemic in August in 2010. So right now in Nakuru town, there are those who have been reported, and there was that news yesterday where they were talking about swine flu, that there is outbreak in another place in Nakuru. So what are the signs and symptoms? Because it can be a pandemic right now in Nakuru, or it can be an outbreak right now in Nakuru, but you get that people travel. Somebody can travel to this place or to your place and you get the swine flu. So that is why I'm going to talk about the signs and symptoms, how to prevent, or how, because right now it is an outbreak, how can we prevent it from, how can we prevent ourselves from getting it, or the people who are there and the people who are living in Nakuru and maybe they don't know how what they can do to prevent this disease. Maybe this information will help them. So what are the signs and symptoms of this swine flu or homa ya nguruwe? The first sign is fever and cough. The second sign is sore throat, running or stuffy nose, body aches, chills, fatigue, diarrhea, and vomiting. Those are some of the signs and symptoms that somebody will experience when you have homa ya nguruwe or swine flu that they were talking about yesterday on the television, on all those stuff of information. So what is the incubation period of this swine flu? What do I mean when I say incubation period? Incubation period is the time that you get a disease or you get infected, to the time the signs and symptoms will appear. So what is this incubation period? Incubation period of swine flu is 1 to 3 days after exposure to the virus, and it continues for about 7 days. So some people will ask, when will I know that I have swine flu, and when will I be able to see the doctor? You should see the doctor when you are still generally healthy and you experience high fever, body aches, and cough. That is when you can see the doctor and you will get help. So I've said that the causes is the influenza virus, and it affects the nose, the lining of the nose, the throats, and the lungs. and the virus enter into the body when you inhale contaminated droplets from the nose, the eyes, and the mouth, or the surfaces of the things. So who is at risk of getting this swine flu? Because not everybody will get swine flu. Of course, you know, right now it is an outbreak in Nakuru. So the risk factors, or who is at risk of getting swine flu, is travelers to affected area. Right now, if you are traveling to Nakuru, you are at risk of getting swine flu or homa ya nguruwe. Another thing, those who those who get exposed to virus, especially those who are dealing with those patients right now, are at risk. Those are the nurses, the doctors, the CEOs, all health workers that are especially right now, they are dealing with those people who are affected with this kind of disease. And also another risk factors is crowded places. Right now, you should avoid crowded places, or when you are at place like right now in Nakuru, people should avoid those crowded places because you might contract swine flu. Another group of people who are at risk are farmers. Farmers also are a group of people who are at risk of getting this swine flu, especially those who are farming pigs. They are at risk of getting this disease. And also I don't know how to pronounce that word, please excuse me. Veterinaries, the doctors of animals. Those are the people who are also at risk of getting this disease. So what are the complications of swine flu? You get that, I think they said that there are some people, a kid, I think a kid or some people have died from this swine flu, and I know they died because of this complication that I'm about to say. So what are these complications that can come out, or can come when you have a swine flu, or these complications are the one that will cause death? So number one complication is heart diseases. If you have, because this thing affects the throat, the nose, the lungs, and even the lining of the nose, you will get that if it affects it will affect, you know, if it affects the lungs, obviously it will affect the heart, because the heart pumps blood to the lungs so that it can get oxygenated. And if the lungs is already affected, then automatically the heart will also be affected. So you will get that you will contract or you get heart diseases. You can also get diabetes mellitus, I think, because of, if the heart is affected and the heart is the one pumping the blood to all other organs, then pancreas also can fail and you can get diabetes mellitus. Another thing is asthma. Asthma is obvious because it affects the lungs, and the lungs is the one that pumps, that oxygenates the blood that we have. And also somebody can suffer from pneumonia because of the infection on the lungs, and also respiratory failure, the same thing. Neurological signs, which ranging from confusion to seizures, or convulsion. Those are some of the complications that will set in when you have swine flu. So what are the treatment, or how can we manage this swine flu? Because virus doesn't usually have treatment, we usually only manage the signs and symptoms. The signs that I already, the fevers, the cough, the body aches, those are the signs and symptoms that we will manage. So this swine flu can be managed by antiviral drug like zanamivir, oseltamivir, among other drugs that you can be prescribed so that they can relieve the signs and symptoms. So the most group that is at high risk right now are the healthcare workers, children below 5 years because they have low immunity, especially below 2 years because they have low immunity, and also above 65 years because of low immunity. When you are getting old, your immunity also is getting old. So you get that when you are getting old, the immunity usually become down. Your body cannot fight against infections. That is why you get that old people are at risk of several diseases, and pregnant mothers also because low immunity, and also postpartum mothers, especially 2 weeks from delivery. Any person with chronic illness are also at a high risk. Immunosuppressant due to maybe HIV infection or any other disease that suppress immunity are also at risk. Another group of people, those are obese and long use of aspirin because of Reyes symptoms. I don't know how to pronounce it, because of Reyes symptoms, and it is a rare case. And how can we prevent this swine disease or HOMA ya nguruwe? So these are some of the prevention that we can put in place so that we prevent contracting this disease. The first one, if you have a sick patient or you have a person who has suffered this disease, stay at home. Number one, stay at home if you are sick. After going to the hospital, you get treated, the signs and symptoms reduce, please stay at home. It's look like corona, but it is not corona. The second thing, wash your hands frequently with soap and running water. This is because you can contaminate your hands from the droplets of an infected person, and if you touch your mouth, your nose, you can get infected. And also cover your mouth when you are sneezing or coughing, because you will spread the droplets to people who are not infected, and they can get infected. So another thing, you avoid contact, that is especially you avoid crowded places, so that other people who are not infected and you are infected cannot get the disease. And then also the last one, the last one, you reduce exposure within your household. You can take this precaution also just within your household or within your environment. So guys, if you're watching this video and you have not subscribed, please subscribe. That is the only way you can support me and you can support this channel. Like my video, share, so that everyone can get to know what we are talking about. It is not bad to share. It is not a must that you just get the information, you keep it for yourself. Share to other people, share to your friends, and tell them there is good information here, so that we grow as a family. And also make sure you tell them to subscribe so that we grow as a family. Let's meet in my next video. Bye.